Morning, ladies. Today we have a webinar on gastritis. So we have Jaisurya with us. Good morning, Jaisurya. Jaisurya, am I audible?
Yes, sir. Happy morning, sir.
Happy morning. So we should start the session, Jaisurya, probably.
Yes, sir. Happy morning, folks. This is Jayasuriya from Tago Medical College. I would like to put up my views on the topic gastritis as far as today is concerned. Now, first of all, we'll start with something like the anatomy of the stomach, the so-called unavu pai in Tamil. Now, this stomach has got 4 layers, starting from, you could see in the slide, right? The outermost being named as serosa, the muscularis, submucosa, and mucosa, where we are gonna concentrate more about the innermost layer that is called as the mucosa. Now, first of all, what is gastritis? Gastritis is nothing but inflammation of the innermost layer, that is the mucosal layer. Inflammation or irritation of this innermost layer. And on the other hand, if this inflammation is spread towards, to the whole of the stomach, then it can be called as pan-gastritis. On the other hand, if only it is towards the part of the stomach, then it is generally termed as medically termed as antral gastritis. Now, it is one of the most common problems affecting the stomach. As a result of breakdown, that is, whereas this mucosal layer, that is the innermost layer, acts as a barrier, right? What will happen if this breaks down, or it has got some incisions in it, or if it gets damaged? The stomach tissue will be unprotected from the digestion by the hydrochloric acid and the pepsin, which is being secreted by the cells that are present in the mucosa. Yeah. Now, coming to classification of gastritis, it can be classified into acute and chronic. Now, let's talk about acute. It usually stems from ingestion of corrosive, erosive, or infectious substances, and even due to taking of aspirin and other non-steroidal anti-inflammatory drugs. On the other hand, taking a chemotherapy drugs along with steroids and so on. Now, this gastritis, that is the acute gastritis, is also caused due to the food substances, including the excessive amount of the tea, clove, and having a pepper in the food too. Acute gastritis is usually of short duration unless the gastric mucosa has suffered an extensive damage. Now, coming to something called as chronic gastritis. Prior to that, I'd like to mention about how this damage is taking place. The mucosal lining of stomach normally protects it from the action of the gastric acid, which I mentioned earlier. This mucosal barrier is composed of something like called as prostaglandins, the other group of chemicals which is helping to protect the mucosal layer from the damage. Due to any cause, this barrier is penetrated, and hydrochloric acid comes into contact with the mucosa. On the other hand, injury to small blood vessels and even a swelling and bleeding to occur if prolonged. Now, coming to what are all the causes that are, what all could be the causes for this gastritis? The acute gastritis. What could be seen? The clinically, what are all the symptoms? Not symptoms. What could be seen? There can be vomiting, nausea, bleeding, and pain in the epigastric region. Epigastric, in the sense, the uppermost region of the abdominal region. On the other hand, the causes include the bile reflex, along with the infection of the bacterial infection, to be more precise, the Helicobacter bacteria, Helicobacter pylori, a bacteria that lives in the stomach lining. And without treatment, the infection can lead to ulcers, and in some people, it may even lead to cancer. As I mentioned earlier, gastritis can be caused by irritation due to excessive alcohol use and chronic vomiting, stress, uh, or the use of certain medications like the non-steroidal anti-inflammatory drugs and so on. On the other hand, there is something called as this bile reflex, where there is a backflow of the bile into the stomach from the biliary tract. What happens if it is left untreated? Uh, there can be risk of stomach cancer, as I mentioned. Now, coming to what are all the symptoms of gastritis? Signs and symptoms. Yeah, symptoms of gastritis vary among individuals, and also the age among the age group too. In many people, there are no symptoms at all. However, most common causes or these symptoms could be something like abdominal bloating or pain, which I mentioned earlier, indigestion, even the burning effect or the gnawing. We can call it as gnawing effect too in the stomach between the meals, and even hiccups along with the loss of appetite, vomiting of blood or coffee ground like material. And if it was too complicated, I mean, if it was left untreated, even black tarry stools can be seen. Now, coming on to diagnosis part, although even after suspecting of gastritis, after taking, after talking about the medical history and performing examinations by your doctor, you may also have one or more functional tests. To be more precise, I mean, if the doctor uh, fascinates to pinpoint the exact cause, something like either it could be the bacterial cause or the cause due to the ingestion of the NSAIDs, that is the non-steroidal anti-inflammatory drugs. So now coming to tests, I mean, for the Helicobacter pylori, you may be recommended to test, a series of tests to determine whether you have the bacterium, the Helicobacter pylori. Which type of test you'll have to undergo depends upon the situation, and Helicobacter pylori may be detected in blood tests too, and along with the stool and breath test too. Now, for the breath test, uh, you'll be asked to drink a glass of clear, tasteless fluid that contains radioactive carbon. Uh, the Helicobacter pylori breaks down the test fluid in the stomach. Later, you're asked to blow it into a bag, which is then sealed. If you're infected, the Helicobacter pylori uh, in the breath, in the breath sample, will contain the radioactive carbon. On the other hand, the as you could see in the slide, using a scope or to examine the upper digestive system through these instrument called as endoscopy. During endoscopy, generally a doctor passes a flexible tube equipped with a lens that is generally termed as endoscope down the throat and into the esophagus, that is the food pipe, then to the stomach and to the intestine until the small intestine. Uh, Using this endoscope, the it can be easily detected whether the stage of inflammation, if it was present. So, if a suspicious area is found, a small tissue sample is also being removed for biopsy. For clinical examination, as fascinated by the doctor. And on the other hand, X-ray of the upper digestive system, sometimes called a barium swallow or upper gastrointestinal series. This series of X-rays create images of the esophagus, that is the food pipe, the stomach, and small intestine to look for abnormalities. To make the ulcer more visible, as I mentioned earlier, the white metallic fluid containing barium that will coat the digestive tract is being asked to ingest. Now let's move on to the treatment part. treatment of gastritis depends upon the specific cause. Now, acute gastritis can be non-steroidal, can be caused by due to non-steroidal anti-inflammatory drugs or alcohol, maybe relieved by use of, stoppage of using of those substances. Now, coming to the medication part that is used to treat the gastritis, antibiotic medications like that are used to kill the Helicobacter pylori. For Helicobacter pylori in the digestive tract, most of the doctors might recommend a combination of antibiotics. Uh, to be more precise, something like the metronidazole, clarithromycin, and other so on medications like amoxicillin and so on to kill the bacterium. To be sure to take the full antibiotic prescription. Usually, it is taken in a series of 3 to 4 days, uh, from even to 7 to 14 days too. Now, coming to the medications that block the acid production, so that the intestinal mucosal layer, that is innermost layer in the stomach, doesn't get excoriated. The medications that block the production, acid production, and promote healing could be the so-called proton pump inhibitors that reduce the acid by blocking the action of the parts of cells that produce this acid. These drugs include the prescription that over-counter the medications, something like the omeprazole, rabiprazole, even esomeprazole, and so on. A long-term use of these proton pump inhibitors, particularly at high doses, might increase the risk of having the hip, wrist, and other joint pains. So even the doctor may ask you to take calcium supplements if needed. On the other hand, coming to something called as probiotics, which are basically living microorganisms that are found in fermented food. So if the intestinal mucosa, that is that which contains the good bacteria, that is the fermented ones, which help for the passage of food and even digestion of the food which is being stored in the stomach, has to be regenerated as the innermost layer, that is the mucosal layer, is getting excoriated due to the or excoriated or eroded due to the effects of the hydrochloric acid which is being produced by the stomach. So prebiotics are being taken, are being prescribed by most of the doctors. Now, coming to prevention, eating habits. Eating habits, I'll talk about it very soon. Having a less intake of alcohol along with quitting smoking plays a key role. Even managing stress plays a key role in avoiding gastritis, where colloquially the most of the mothers used to say, "Oh, you must not something like அழுதுகிட்டே சாப்பிட்டா சாதம் வயித்துல ஒட்டாதுடா." So they will ask us to wipe off the tears and have a happy meal. So something like that. Stress is the major cause for most of the diseases. Now, moving on to complications. If left untreated, the complications of gastritis may lead to severe bleeding and other diseases like other clinical conditions like pernicious anemia, and even, as I mentioned earlier, it might even lead to stomach cancer. And due to malnourishment, lack of, there will be a discomfort and decreased, due to the malnourishment caused by inadequate intake of food, other comorbidities are also there that could deteriorate the health. Now, coming to the dietary management, eating certain foods could worsen the symptoms. But first of all, let's talk about what are the foods that could be avoided. The foods that cause the inflammation and worsen the condition like the high fat, and those that irritates the stomach wall like the alcohol. Acidic veggies too can be avoided like the tomatoes, and on the other hand the citrus fruits, which can also be avoided. And coming to this carbonated drinks and spicy foods, along with the the add-ons like the chili and the pepper, and the fried foods has to be avoided. On the other hand, beverages containing to be more precise, the caffeinated drinks has to be avoided, and it's better to have avoid a large amount of liquid at once rather than to have in small amounts. Now, what are the foods that can be taken? The foods which has got high fiber content, the whole grains, cereals, green leafy vegetables, eggs, lean meats, and so on. Now, it's something like you must not eat 2 hours from the time before the bed. That is the period of the so-called period is. The period is called as gastric emptying time. It gives enough time for the digestion without overload of the stomach. Now, you can eat in small amounts periodically rather than having a huge bulk amount of food in a single go. Now, coming to the things that has to be avoided. Let's Dairy product has to be completely avoided during this period of gastritis. That is, if it was acute, then it's gonna be something like 3 to 10 days, and gradually, if it was chronic, the chronic which I mentioned is caused due to the autoimmune diseases or uh, I mean uh, autoimmune diseases, and uh, prolonged condition of the acute gastritis also may lead to chronic gastritis. Now, coming to the dairy products, as already the HCl will have a concentration of around zero point 0.4 to 1.7 in the stomach. What will happen if once again if we add milk and milk and other dairy products, something which will increase, which will reduce the pH, that is which will increase the acid content where the milk has got the lactic acid. So it's something like adding a drop of lemon juice in a cup of milk. What will happen? It will completely disintegrate, right? So the same thing happens in the stomach too. Yeah. Now coming to peptic ulcer. What is peptic ulcer? Now the acid of the gastric juice or the pepsin that is being secreted by the cells of the stomach produce damage to the the internal lining that I mentioned earlier, the gastric mucosa, in abnormal condition. Therefore, the peptic ulcer is caused either by decreased mucosal defense or by the increased secretion of the acid, or even by the infection too. Yeah, now the doubts, please. Thank you.
If you have any doubts, you can just post your doubts in the chat as well. Jaisuriya, there are a couple of questions for you there in the chat.
Yes, sir. Thank you, sir. Yeah, Mr. Akash Gopal, good morning. Yes, I have something like are heartburns related to gastritis? First of all, let's be clear what is heartburn. Heartburn, I mean, when does it occurs? It occurs when the stomach acid backs up into the tube, that is the food tube, which is carrying the food from the mouth to the stomach. Normally, when you swallow, a band of muscle around the bottom of the food tube, that is there's a muscular sheath which prevents the food flow from the food tube to the stomach. Now, the food, now this this band of muscle has to relax in order to make the food from flow from the food tube to the stomach, that is esophagus to the stomach. Now, what will happen in case of heartburn? The stomach acid, that is the acid that is in the stomach, regurgitates. To be more precise, it flows back into the food tube, which will cause irritation and immense pain, that is called as heartburn. So even heartburns are related to gastritis. Thank you. Yeah, Mr. Rohit, I feel the symptoms you just mentioned. Then just meet a doctor, Mr. Rohit. That would be the best idea. What tablet should I take? It depends upon the doctor's prescription, but in case of, to be more precise, he will just prescribe something like the proton pump inhibitors or the something called as sucralfate, which I mentioned earlier, where it provides a protective layer. I mean, something like one more coating on the ulcer, so that more acid doesn't harm the innermost layer, that is the mucosal layer. Yeah, happy morning, Mr. Nitin. If the symptoms are recurrent, even after having medicine for about a week, what can be the next step of treatment? Yeah, Mr. Nitin, it's something. It depends upon it's between something like you and your doctor, where if there is even after the treatment with medications and balanced diet, which is prescribed by the doctors, you are not able to cure this symptoms. Recurrent symptoms for the gastritis. There is something called as there are other treatments like surgical treatments, where the if there was a condition, a chronic condition, and where there is hypersecretion of the hydrochloric acid, so that there is a procedure called as vagotomy and selective vagotomy. Now, what is vagotomy and selective vagotomy? Vagotomy is nothing but the nerves that are supplying, the nerves that is supplying the stomach is called as the vagus nerve, that is the 10th cranial nerve, where in case of this vagotomy, there won't be any in case of this vagotomy, the vagus nerve is being cut, and so that there won't be any there won't be any secretion of acid, first of all, due to the lack of stimulation from the nervous system in order to secrete the hydrochloric acid. Yeah, thank you, Mr. Nitin. Now coming to Mr. Ashok Kumar. Yeah, happy morning, sir. Can diabetes cause gastric problems? Obviously, I didn't mention about this, but I would like to add upon something like the type 1 diabetes, which is also a kind of autoimmune disease, which will in turn cause the gastritis. Thank you. Yeah, Mr. Ghosh Pira, frequent use of Digene or Gelusil syrup without consulting a doctor, is there any problem? Yeah, actually, first of all, consulting a doctor is the best way of treating a problem, that is a medical error that is occurring in the body. So you better consult your doctor, where it won't be a great deal, but consulting a doctor would be the best option. Thank you. Yeah, Mr. Gopal, what kind of food should we avoid? Uh, yes, Mr. Gopal, as I mentioned earlier, something like the citrus foods and having a less alcohol consumption, and on the other hand, taking less spicy food, something like we term it as a bland food, where there is no uh, irritants for the mucosal membrane that could damage it. And you must definitely avoid the dietary products, and on the other hand, along with the uh, the carbonated drinks which has got high cocaine. Not cocaine, sorry, caffeine. Thank you. Yes, Mr. Gopal, but plant sources like chickpeas, legumes tend to cause more gastric secretion, right? Yeah, of course, yes. But I mentioned you to take something like more food, the food with more fibrous content. Wait, I'll just show you that slide. Actually, I didn't add up, it seems. But you must have something like a huge amount of fiber content, where basically there must not be any irritants for the mucosal membrane, which is causing damage to it. So avoiding them will not make them get excoriated. Yeah. Yeah, having Miss happy morning, Miss Gopika. Is it okay to take ulcer medication in case of repeated ache in stomach or abdomen, or what other tests could we taken in such case? Yeah, I mentioned in my presentation something like the barium meal in case of chronic gastritis, which depends upon the doctor's uh, ideas, and the state of your body, and the doctor, it depends upon the doctor, where he can use an endoscope to find the level of the injury. On the other hand, he can use something like the barium meal, and so on. And you can't be repeatedly taking medications without a doctor's prescription. Thank you. Yeah, if the medication doesn't work on a long run, what other tests would be taken? Uh, if the disease is not yet cured, then the doctor will prescribe something like the gastrin blockers prior to, I'm talking about something prior to the vagotomy. That is completely blocking the gastric acid secretion is different from other medications uh, like the muscarinic blockers and the gastric blockers, which can be prescribed even after, if your disease is not cured, then the doctor may ask you to uh, opt for the vagotomy. Yeah, thank you. Yeah, Ms. Gopika, what kind of drugs on chronic intake can cause mucous membrane irritation? Drugs like ibuprofen, which I mentioned earlier, the non-steroidal anti-inflammatory drugs, uh, and even taking cocaine will cause inflammation of the mu- mucosal membrane of the stomach. Yeah, thank you.
Any more questions, people?
And Mr. Gopal, I would like to add something for you, something like what has to be avoided. Avoiding sugar is also an very crucial, because in every case of gastritis, sugar makes the symptoms worse. Not only it does destroy the stomach lining and cause inflammation, it also feeds these bacteria, the so-called Helicobacter pylori, which is making them more resistant to the drugs which is being prescribed by your doctor. Yeah, thank you. Oh,
Fine. So I guess that's all about the questions. Thank you so much, Jai Surya.
uh, thank you, sir. Glad to work with you.
Yeah. So thank you so much, people, for
Good day.
connecting with us. Yeah, good day, good day. And I've shared you the feedback link here in the chat. So kindly make your feedback in this particular link. The link will be active 12 midnight. and they have posted a G-page review also. You can just post your review. And for your kind information, people, we are stepping on to the 100th webinar on 2nd of September. So if you are interested, you can just get back to us in the website. You can see the live chat there. You can just get back to us there, where we will be assisting you how you can just be a part of this 100th webinar. And you can just post your video testimonials also with us, and we'll be glad to post that video in the webinar and also there in YouTube. Thank you so much, people, for connecting with us once again. We'll meet you on 1st of September, that is on Tuesday. Until then, happy weekend. Stay connected. Bye. Good night.